So this is an X-ray of a unicompartmental knee arthroplasty. This is also called as a UKA or a microplasty. So this is basically a technique in which we don't change whole of the knee joint, but we change only a part of the knee joint. So this is called as a unicondylar knee replacement, half knee replacement, or this system specifically is called as a microplasty. So you must have heard about total knee replacement, which is a more commonly performed surgery. But this is a more specialized surgery which we can do in specialized indication. So for this surgery to be performed, the patient should have a specific only medial compartmental osteoarthritis. There should be no changes of osteoarthritis on the lateral side. The ligaments of the knee, that means MCL, LCL, ACL and PCL should be normal, and the patellofemoral joint should also be normal. So if rest of the everything of the knee is normal and you have only the medial side of the joint which is worn off, then unicondylar knee replacement is a better surgery than total knee replacement. Why? Because it is a smaller procedure than total knee replacement. We have to do a less invasive surgery. The blood loss to the patient is less. The cuts that we make into the bone is less. So it's a bone preserving surgery. It's a blood preserving surgery. It's a very safe surgery, very fast and efficient surgery for the patient. Besides that, you have the ligaments which are intact. You have all the knee structure which is otherwise is intact. So there is no risk of any other added complication. So it's a low complication surgery, faster recovery surgery, and the patient will be able to achieve a more higher level of activity if we do this unicondylar knee replacement surgery as compared to a total knee replacement surgery. So let's say the target for me to do a total knee replacement is to make a patient walk normally. If I am doing a total knee replacement for any of the patient, my target is that patient should be able to walk normally. But here, my target will be little higher. That is, my target will be the patient should be able to cycle, should be able to swim, should be able to jog, should be able to do more sports kind of activity, because it's a knee preserving activity. Rest of the knee is normal and only those portion which is damaged is changed. Now this particular joint is called as an Oxford knee joint. Oxford knee joint is a joint from a Zimmer Biomet company, and this is called as a mobile bearing knee. This is a little higher than your standard, but you should know that. So this is called as a mobile bearing knee. By that we means is that there is a poly in between. So this is a metal, this is a metal, and there is a poly in between the two metals, and this poly is mobile. So this is also called as a mobile bearing or meniscus bearing, and this particular design has the lowest wear rates among all other unicondylar knee replacement. So the success rate of this particular knee replacement, unicondylar knee replacement, is very good. It's a low invasive surgery, so it's a very good choice for those patients who are having solitary medial compartmental arthritis, because we can give a very good result and very good function to these patients as compared to a total knee replacement, which is a more performed surgery. So whenever indicated, ideally the patient should consider doing a unicondylar knee replacement surgery, because we could give a better results as compared to a total knee replacement surgery. You have any questions regarding this? Okay, thank you.